We have the means to reform health insurance in America, and I'll tell you why we should. If any other industry was run like healthcare in America, this is how it would go. My favorite, most decadent food is crispy fried chicken, and let's say I wanted to go out to a restaurant and order as much as I could. The waiter, which is just supposed to take my order and then get me my chicken, instead tells me, oh no, you can only order a certain type of fried chicken and only a certain quantity of that. Anything further, then you're going to have to pay extra. An even better example, and this happens quite frequently in the health insurance industry, is let's say I am starving, and the only thing that could cure my starvation is this fried chicken. And I place an order to the restaurant saying, okay, I need this much fried chicken, and I've given them the money already. The credit card transaction has gone through. Yet when I show up to the restaurant, at the edge of death from starvation because of how bad I need this fried chicken, the restaurant says, oh, I'm sorry, but we can't provide this for you. But thank you for your money. Goodbye. And the company that had the highest incident of denying hungry people their fried chicken was United Healthcare. Wasn't always like this. Up until the 1970s, we just had a pay-as-you-go service for healthcare. That's right. Up until the 1970s, if you needed some kind of medical service, provided it wasn't too advanced, you just paid for it, and the cost was much lower than it would be today, even in back then's dollars. Now, don't get me wrong. If you needed something like surgery or much more complicated medical care, yes, that was expensive, and Americans still dealt with a lot of financial hardship, even ruin, because they wouldn't be able to afford it if they were poor. We all know the vast majority of doctor visits or any other kind of medical visit are non-acute cases, which can be treated with very simple equipment. From an economic standpoint alone, there is much more benefit for everybody being able to have access to some type of care than the 27.1 million Americans that have none. For the majority of Americans, there was no need for health insurance because they didn't have to deal with a lot of these acute cases up until the early 1970s. But of course, there were some people who thought it was necessary to have insurance just in case, because there were private options available, like Blue Cross Blue Shield. That was around since the 1930s, the 1940s. So up until the 1970s, the vast majority was pay as you go, and everything was very cheap. And the exception to the rule would be health insurance, which was of course private. And the overwhelming majority of these health insurance companies were not for profit. They didn't see any sense in profiting off of just someone being able to pay their health care. That was the case until 1973, when Richard Nixon finally approved for-profit health insurance companies. And the line this guy sold was that these healthcare companies would be run much more efficiently because they had to answer to shareholders for profitability and efficiency. And very quickly, private for-profit health insurance companies started to become the norm, and the state option became the exception. And the state option that came to be as we know it were Medicaid and Medicare in 1975. This was the first time the US government actually set its foot into health insurance and just overall medical care. And it's something that never should have happened. Unless it comes to collecting taxes or spending on the military, the US government is an incompetent bureaucracy. All the bureaucracy knows how to do is to inflate itself and become even less efficient as time goes by. And the vast majority of the American public has to deal with either an overblown bureaucracy that can barely deliver the necessary healthcare or compensate what's needed, or be at the mercy of these for-profit health insurance claims that are much more interested in showing good numbers for their shareholders than actually allowing healthcare to be administered. And even though it was the conservatives that brought for-profit healthcare onto the stage, that industry now funds both the Democrats and the Republicans. But what you guys have to realize is that all of these health insurance companies, United Healthcare, Medica, Anthem, Aetna, all they are middlemen to your healthcare. The most prosperous eras in American history took place in the 1950s and 1960s when these guys didn't even exist. You just got to your healthcare directly. And there's nothing that should be stopping us from doing that today. If you have cancer, diabetes, or you just got cut and need stitches, there should be no third party blocking you from getting the care you need at the hospital or the doctor's office. Health insurance can be a great thing as long as it is not for profit. And it serves as a great option for something in case of an emergency within a system that just has pay-as-you-go medical service. The first step all of us can take is start looking for whatever not-for-profit insurance companies there are, like Kaiser Permanente. And look at this, they have one of the lowest rates of claim denials, 7%. While voting is important, there are always going to be politicians on both sides of the aisle that tell you why health insurance companies are bad, but very little gets done. The only way we can really take care of this is to arm ourselves with knowledge and start voting with our dollars. And here's a bit of insight a lot of us may not have known. The more people that join an insurance network should mean lower costs across the board because there are more people contributing. Here's a list of 10 not-for-profit health insurance companies. They still cost money, but they are relatively cheaper than their for-profit competitors. But you guys can make your own kind of health insurance as well. If you're in a church or just a good community of people, you all can start contributing a small amount of money every month for healthcare expenses in the event that one or more than one person has some kind of health emergency. You have to comply with some state or other local regulations, but it's not illegal. But the most effective thing all of us can do is to arm ourselves with knowledge of how insurance is supposed to work. And of course, which companies actually provide better insurance. And this issue should be at the top of everybody's docket because everyone is affected by some kind of healthcare emergency in their lives. Who knows? I know what I said before about politicians, but if this issue does become pertinent enough, we may see politicians actually start to address it if it is a widespread concern that's actually vocalized. I am the Geo Husar. For-profit health insurance is a cancer on society, and we should be removing all of the tumors. Thanks for watching.